Well, hi everybody and welcome. My name is Neil Seidman and I'm the co-chair of the Public Education Committee for ADAA. That's the Anxiety and Depression Association of America. So welcome to our webinar, Problems with Sleep, Treatment Approaches for Kids and Teens. And our presenter is Dr. Joseph Brandt. Now, before we start, I'd like to say just a little about ADAA, the Anxiety and Depression Association of America. So ADAA was started back in 1979, and today it's the leading nonprofit organization in the field of anxiety and depression. Our mission is to improve diagnosis and promote the prevention, treatment, and cure of anxiety, depression, and stress-related disorders through education, like this webinar, practice, and research. And we work to end stigma and get the word out that these conditions are real, they're serious, and they're treatable. I'd like to invite everybody to visit the ADAA website. It's really a wonderful resource. It's adaa.org. And one of the things you'll find is a really great list of treatment providers, as well as a free peer-to-peer online support group. And you can support ADAA by making a charitable donation on the website. So I'm really happy to introduce our presenter. Dr. Joseph Brandt is a clinical psychologist. He specializes in treating insomnia, anxiety, and depression, and he uses cognitive behavioral therapy, CBT for short, and mindfulness approaches. Dr. Brandt is affiliated with a clinic called the Center for the Treatment of Anxiety and Mood Disorders, located in Delray Beach, Florida. And the center's website is centerforanxietydisorders.com. So let me turn it over now to Dr. Brandt.
Okay. Thank you, Neil. Thank you for the introduction. Really excited to be here today and get to be part of this webinar series. So let me just get my slides up here. So we're going to be talking about sleep issues specifically for kids and adolescents. Specifically, we're going to be talking about some behavioral sleep issues and how to manage those issues behaviorally. So we won't focus too strongly on some of the medically based sleep issues, such as sleep apnea per se, but we will be focusing on a lot of behavioral issues related to kids and teens. And the reason why I want to get a lot of this information out to the public is, in my work at least, I see so many kids and teens who come in with anxiety, they come in with depression, they come in with behavioral management issues, and I notice a very common theme of poor sleep, whether that is kids who won't fall asleep, or once they go into their bed they keep popping out of the bedroom, or teenagers, high school students who are up until 3 in the morning, but then they got to be up at 6 a.m. for high school the next day, and they're just exhausted. And there are so many times where I've been working with folks and have thought to myself and verbalized to my clients, hey, look, if you were sleeping better, you'd probably be a little more equipped to handle a lot of the other stuff that's going on in your life. So sleep is so essential, and so many people struggle from it, kids, teens, adults, that the more information the public has in terms of how to manage these problems, the better. So how much sleep does my child need? And this is a good question, because the answer really is that it depends. You know, sleep patterns change throughout development, and the amount of sufficient sleep is really different from person to person. And that's true for kids, it's true for teens, and it's also true for adults. You know, even the kind of the 8 hours per day that adults are instructed to get, well, that really kind of varies from person to person. Some people might be able to function on 6.5, 7. Some people need 8.5 or 9, and it just kind of depends, and it's no different for kids and adolescents. So the numbers that you see here are per the National Sleep Foundation. And these are just
I'm noticing, Dr. Brand, that on this slide you can just see how the need for sleep changes as the child grows up
it
quite
decreases.
dramatically. Yeah.
Yes, it decreases over those first few years. By the time you're 6 years old, the lower range of what is recommended is almost half of what you need when you're a newborn. And so it changes a lot, and not just how much sleep a child needs, but when they sleep. Newborns, they kind of sleep throughout the day. Those 17 hours that you're getting, those 14 to 17 hours are just kind of whenever they're sleeping. And by the time you're moving into childhood, their circadian rhythm changes, and now they're getting all that sleep at night. So it's not just quantity, but it's quality as well.
And sleeping at night is better for the parents.
It's way better for the parents and siblings and anybody else who might be in the house. Yeah, that's obviously what we're shooting for here.
I'm also noticing from this slide, as you started saying, that there's a lot of individual differences.
Mm-hmm.
And if you look at each category, there really is a pretty good range of what that child might need.
Big range, and that's going to be important to keep in mind as we kind of progress through the presentation here, because what you see a lot of is parents who are being good parents with set boundaries, and they have the same bedtime for their kid every night, and maybe that works when they're 2, 3, 4 years old, but then around 5, 6 years old, all of a sudden that bedtime doesn't work anymore, and the kid is giving you problems. And it might not be that the kid has this oppositional issue going on, but their wiring might be changing. And instead of getting to bed at 8 o'clock, let's say, really they're not going to tire out for another hour or so. So those personal differences are really important to keep in mind as we talk about some of the specific issues here.
And I like leaving this slide up for a couple of minutes so that parents can maybe make a note if they want. Based on the age of their children, and then also if you're making notes at home, make a note about that range just so that you can see that there's a lot of individual differences.
Yes, absolutely. And I encourage parents, if you think that your kid or teen is having sleep issues, do yourself a favor and track their sleep. Keep your own log and see when they're going to bed, when, obviously a ballpark of when they're falling asleep, when are they waking up. It's always helpful to get a snapshot of what your kid's sleep patterns are, because that can say a lot. That can give us a lot of information. Okay. Do we want to keep this up? Do we want to?
Yeah, you could go on, I think.
All right. Sure. So, what are the consequences of poor sleep? They're far-reaching. There can be difficulties with emotion or behavior regulation, increased depression or anxiety, cognitive difficulties, memory, learning, and attention, and you can only imagine how that impacts a kid when they're at school and trying to stay awake and trying to focus and perform well. It can really hinder academic performance. We know that inadequate sleep can impact our immune system, and it can disrupt the family unit. When a kid isn't sleeping well, a lot of times nobody's sleeping well because they're either bouncing from bedroom to bedroom or very upset and tantruming, and now the parents are up, and now the sibling who doesn't have sleep issues is up, and a lot of these same issues in terms of emotional difficulties, cognitive difficulties. Now it's not just the poor sleeper who's having those issues, but it's the entire family unit. And like I said, managing your life, managing day-to-day stressors takes energy, and sleep is restorative. And when we're not well rested, it's really hard to do that. You know, think about how much more likely you are, talking to the audience, to get more angry than you usually do after a poor night's sleep, or be more sad than you usually are, or just feel like you're having an off day of work because you can't get your focus together. Um, that is no different for kids and teens. So how can I tell if my child is having sleep trouble? Well, a lot of times it's very obvious. A lot of times it's obvious because, well, when you're trying to put them to sleep under conditions that they don't like, they are throwing tantrums or they're becoming very upset. Or you put them to sleep and they go to sleep okay, but they're bouncing out of their bedroom 3, 4, 5 times a night. Um, so, but if it's not obvious, there's a screener, and you can find it online. And if anybody would like, they can email me, and I can send it to them. Called the Bears Sleep Screener. And Bears is specific for childhood sleeping issues, and it stands for bedtime problems, excessive daytime sleepiness, awakenings during the night, regularity and duration of sleep, and snoring. And I'll go over these a little more specifically on the next slide.
So just the acronym, the BEARS, sounds very helpful if people want to jot down some notes as they're watching. You're saying there's something more detailed than this that's like a screener, like a questionnaire?
Yeah, there's a questionnaire. There's a Bears questionnaire, and you can find it online. And if you're going to a sleep specialist, let's say, a lot of times they'll give you this. And then when I'm working with kids who, the chief complaint is sleep issues, or if I find out that sleep issues are a primary a problem, then I'll give this to them too, or at least
is it a long questionnaire?
No, it's very, very brief, and it won't take more than a few minutes to fill out. And when we go on to the next slide, a lot of the types of questions that you'll see are on the questionnaire. So
if I look up Bears Sleep Screener, like if I Googled it, it might just come right up.
Yeah, you should be able to find it.
Great.
Yeah.
Wonderful.
Yeah, so, and then here we go, a little more specifically. These are the types of questions you'll see. Bedtime problems. So when we're talking about bedtime, are we talking about problems going to bed or falling asleep? So is my kid taking a long time to get through his bedtime routine? Is he refusing to put on his pajamas or brushing his teeth? Or is that routine going okay, but once he gets into bed or she gets into bed, they're just not able to fall asleep? Excessive daytime sleepiness, are they overtired throughout the day, more so than it seems like they ought to be? Are they sleepy? Are they sleeping in school? Teachers can be really helpful to get some information from them. How hard is it to wake up in the morning? We see this a lot of times in teenagers who are up into the wee hours of the morning, but then they got to be up super early for school the next day, and it just takes forever to get going. Awakenings during the night, so maybe you can go to sleep okay, but can you stay asleep? When you wake up in the middle of the night, are you up for a long time? Is your kid coming out of their bedroom to get reassurance, or are they crying in their bed? Sleepwalking is another type of awakening during the night. We'll touch on that a little more later on. Regularity and duration of sleep. To me, this is really important. What is your child or teen's sleep and wake time, and how regular is that? Are they going to sleep at the same time every single night? Are they waking up at the same time every morning? And how different does this look on the weekends? Because maybe they're doing it the same during the week, but once the weekend comes around, or winter break, spring break, and now they don't have the obligation of school, are they going to bed later and then waking up a lot later? And even those couple of days can do a lot to throw off the regularity of our sleep cycle and either lead to or perpetuate ongoing sleep problems.
In general, Dr. Brandt, if a child is having problems with sleep,
Hmm.
is it a good idea to have a regular sleep and wake routine?
Yeah, like of utmost importance. Um, that's where you want to start. And that's not to say that it's going to make it all better, but it's foundational. It's one of those things that is, we would kind of call necessary but not sufficient, meaning that it it's something that really sets the stage for improved sleep. Even if it doesn't improve it completely, wherever you start, you want to start with a good foundation of a regular sleep pattern.
So the body likes that kind of
The body
regularity.
loves that. Regularity is good. Hey, look, even think of we like predictability as people. We like knowing what's coming up in our next day and having a schedule and um, having a to-do list and being able to cross those things off. And our body is not so different from our minds. So if we as people feel more comfortable with predictability, our bodies are the same way in terms of our sleep-wake cycle.
Now, the last item on the bears, the
Hmm.
snoring, that's
Hmm.
interesting. Tell us more about that.
Yeah, so this is what you want to keep an eye out for, specifically related to sleep apnea. And I know I said I wouldn't cover too much today related to sleep apnea because it's more of a medically based condition. But if you're noticing that your kid is snoring on a nightly basis, they're snoring loudly, or that you're noticing some difficulties with their breathing at night while they're sleeping, uh, go get it checked out. Go to their primary, let them know what the issue is, and see if it might be worth them seeing a sleep specialist to do a study and see if they actually are suffering from sleep apnea. Because if that's the case, that's certainly something that you want to get treatment for as soon as possible.
Okay, good. Thank you.
Sure, sure. So here are some of the issues that we are going to be covering in a little more detail today. So we'll cover nocturnal enuresis, which is usually occurring in kids around 5, 6 years old, much more likely in boys than girls. We have behavioral insomnia, which is divided into two different types. And when we get to those slides, I'll speak a little more about the differences between the two and how the treatment kind of varies. Nightmares and nighttime anxiety, and this kind of goes along with separation anxiety too at times. Um, Nighttime anxiety is also something you start to see a lot with older children and middle school kids when, uh, if you have someone who's anxious in general, bedtime in the bed tends to be a really hot spot for a lot of racing thoughts and frustration and discomfort.
And if that's the case, that's certainly not going to help them sleep.
100%. Well, then you get kind of in a little bit of a vicious cycle where you're up, your mind is racing, you are recognizing that you're not asleep, you're looking at the clock, you're realizing, well, I'm not asleep yet. I need to go to sleep soon in order to get a good night's sleep, because if I can't, then I won't be able to do well on this test tomorrow. And oh goodness, how much other work do I have to do tomorrow? And then you're awake, more and more awake. So we'll talk a little bit about how to kind of manage that cycle. So we have night terrors and sleepwalking, and then circadian rhythm issues.
Can we go back to
Sure,
that
sure,
item
sure.
just for a moment?
Hmm.
So
Yeah.
night terrors and sleepwalking, how common are those issues?
That's a good question. I don't have the exact statistics off the top of my head, but they're usually more common in school-age children, sometimes in preschoolers. And something that's worth noting is you usually to see these issues happen in the early part of the night. Usually during the first third of their sleep cycle is when you start to see these issues. Um, they're called non-REM sleep disorders, which means that they are in a sleep state where their REM cycle hasn't kicked in. So, not to get into too much of the nitty-gritty there, but during REM sleep, your body is essentially paralyzed. During non-REM sleep, you can still move. And so that's kind of what's going on here. And that non-REM sleep tends to occur during the first third of the night. So if you're trying to determine whether your kid is having nightmares or night terrors, timing would be really important there, because you're going to see those night terrors happen early on in the evening and those nightmares happening a lot later on in the sleep cycle.
Okay, thank you.
Sure. And then circadian rhythm issues, specifically something that's called delayed phase sleep onset, and that is very, very common in teenagers. We'll talk a little bit about insomnia with teenagers as well, but a lot of times what looks like insomnia ends up being the circadian rhythm issue that just really can wreak havoc on an adolescent's sleep cycle.
So when you say delayed phase, so that would mean the teen isn't being sleepy until later and later at night?
Exactly, and that's usually something that starts to happen, when your kid goes through puberty and as they get into high school, that circadian rhythm changes and is different from childhood. And so, if even as adults we're good about going to sleep at, 10 to 6, 11 to 7, whatever it might be, teenagers, that is all pushed back. So a teenager won't feel tired until 2 in the morning, 3 in the morning even sometimes. And they got to be up 3.5, 4 hours later, so they're exhausted. And the way to really tell is this a circadian rhythm issue is how are they sleeping on the weekends when there are no constraints? Because what you'll see is, a teenager on a school night tries to go to bed at 11, 12 o'clock, and they're up in bed until 2:30, 3 o'clock. They're up at 6 the next day, but then when the weekend comes around and there are no constraints, they're still going to bed at 3 o'clock, but then they're waking up at noon, 1 o'clock. And when you are noticing that they're getting the amount of sleep that they would like with no social constraints, let's call it, that's a pretty telltale sign that maybe it's not insomnia, but really that their circadian rhythm is just delayed, that their internal clock is wanting to be up later and wake up later.
Not to jump ahead, but can you
Sure.
say just a bit about if that was the case, what would I do to help my teen?
So the first thing that you want to do is you want to, again, regulate the sleep cycle. So if their weekend sleep pattern is so different from their weeknight sleep pattern, you want to start to adjust that. An issue that comes up with teenagers a lot is they're older, and they have a little more autonomy. So you got to check in and see how motivated they are to want to do that. Really kind of highlight to them how much of this sleep issue is a problem for you, and what are the problems it's creating, and how much better would your life be if you were getting that regular sleep. But you want to start with trying to manage that weekend sleep cycle and get it on par as best you can with the weeknights. You can always check with your doctor about melatonin, which is effective for circadian rhythm issues. As far as other sleep issues are concerned, kind of varies in terms of effectiveness. Bright light therapy is really helpful. So some of you may
That's
have either.
something that you do in the morning, bright light.
Yeah, well, and at the night and at nighttime too. Some of the folks in the audience may have either heard or read about how all of the screen time can throw off our circadian rhythm, and that's true to an extent, but it's especially true with teens when it comes to this delayed phase sleep. When you are locked into your phone in bed, when you're on your iPad at 12, 1 in the morning, your body's interpreting that as daytime, and that's going to make it harder to go to sleep. So I always recommend winding down from all the technology an hour or two at least before you're ready to get into bed. And then in the next morning, as soon as you wake up, yeah, you can look for these bright all that bright light and wakefulness early in the morning and that lack of light at night to start to regulate your sleep a little better.
Could you repeat that last point? I think I lost that
So,
bit
and,
about it.
and, and if we get there later on, I can say a couple more things about that.
Okay. Thank you.
Okay. Oh, goodness. Oh, no. Can you see me? Or hear
Yeah,
me?
I can see you and hear you. Looks like we have
Okay.
some technology adventures, everybody, but we'll get back on track, I think.
Sorry about that, guys.
That's all right. That's okay. So we're still seeing your slide,
Okay.
behavioral sleep issues in kids and teens.
Okay. Did I get cut off there? Do I need to repeat anything?
No,
Okay.
that's okay. You could go right
Okay.
on. It's fine.
Sure, sure. So anyway,
I took
how do
you
we
off on a bit of a tangent about how
say?
to, hey, that's my teen, and then we had to just hear a little bit about some of the things that might help.
Yeah, I hear you. I hear you. Yeah, and I'm hoping we'll get to a little more of that later on.
Great.
So anyway, the last slide were specific sleep issues related to kids and teens, and like I said earlier, uh, setting the stage, setting the foundation with a healthy bedtime and sleep routine is absolutely essential. So how do we do that? And like I've been hinting at, you want a consistent bedtime and wake time 7 days a week. You really, really do, as best you can. Maybe a 1 to 2 hour difference during breaks or the weekends. Look, personally, I don't think it's fair to wake a teenager up at 6 a.m. on Saturday either. So if they're getting up at 8, instead of 6, that's fine. But you really don't want them sleeping in until 11, 12, 1 o'clock.
Because that's going to be a problem for that circadian rhythm that you talked about.
Exactly. And even think about it. You're waking up at 1 o'clock on a Sunday and you have to be up at 5:30, 6 o'clock for school that following Monday. You're already thrown off. As soon as you wake up at noon or 1 o'clock that Sunday, you're already behind the eight ball for getting your sleep regulated for the upcoming week. And so that's why it's so important to keep it consistent, or one of the reasons why it's so important to keep it consistent on weekends, on breaks. Make it a good habit. It'll be hard at first, but once you get into the routine of it, just like anything else, it's really second nature. I also wrote here, getting out of bed ASAP after waking up. And that's true for going to bed too. You really, really want to keep the bed just for sleep. And it's all too common, kids, teens, and adults alike, to do work or homework in bed, check emails in bed, be on our phone in bed, watch TV in bed, eat in bed. We're not necessarily so great about keeping the bed just for sleep, but we do ourselves a great favor when we do that. So in terms of this consistent bed and wake time, go to sleep when you're sleepy. Go to bed when you're sleepy, rather, and if you're doing any other kind of relaxing activity, do it in another part of the house or another part of the room. And then when you wake up in the morning, don't hang in bed. Whatever your morning routine is, get up and do it elsewhere, even if that's just hanging out, checking your texts, checking your emails. For teens, checking social media. Get on the couch and do that. Leave the bed just for sleep.
So what I'm hearing, Dr. Brandt, is by doing what you're suggesting,
Mm-hmm.
I'm building up an association between lying in bed and sleeping,
Absolutely.
as
Absolutely.
opposed to having associations of lying in bed and texting and working on my iPad, and which are going to
Exactly.
be very wakeful activities.
Yep, absolutely. And the term that we kind of call that is quote unquote stimulus control. And the whole idea is we want a one-to-one association between the bed and sleep, right? So if we're really good about associating the bed with sleep, then our body's going to know to shut down a little bit and tire itself out when we get into bed. But if we're eating in bed and we're texting in bed and we're watching TV in bed and we're doing all these other things in bed, your body is way less likely to associate it with sleep, and it's much more likely to be associating it with alertness and wakeful activities. So,
So,
and you hear this a lot with folks who say, I'm out on the couch in the living room and I'm watching TV and I'm falling asleep as I'm watching TV, but as soon as I get up to go to sleep and I get in my bed, I'm wide awake. And that's because they probably do a lot more than just sleep in their bed.
so moving activities from the bed to, would it be preferable to actually do those activities in a different room?
Yeah, ideally, I would like it to be in a different room. I know how kind of protective adolescents can be of their personal space and their room, and you got to work with what you have, and sometimes it's easier to maybe not go into a different part of the house, but just a different part of the room. Section off the bed from the rest of the room, or section off a part of your room that can be dedicated for waking activities. And that's helpful too if you're a college student living in the dorms. It's not exactly like you have a nice living room to go hang out in when you're up and not being able to fall asleep. But if you can have another part of the dorm room that is dedicated to wakeful activity and keep all that kind of stuff out of bed, that's helpful too.
Okay, so just to kind of reiterate,
Mhm.
we want to build an association between lying in bed, head on the pillow, and sleep.
Exactly. We want to condition our bodies for that. That's exactly right. Yeah. Um, so that's first and foremost. When it comes to bedtime routine, keep it simple, keep it pleasant, keep it predictable. Relaxing and enjoyable activities, whether that's reading a book with mom or dad, doing a little puzzle. If your kid isn't incredibly competitive, maybe playing a little board game together, coloring, listening to music, anything that's nice and pleasant, and obviously not disruptive to the rest of the house. Um, Limit naps. If you have an infant, obviously they need to nap, but a lot of kids stop those regular naps around 5 years old. And if you have a 5-year-old or 6-year-old and they're having trouble sleeping and they're still taking pretty solid naps during the day, that can disrupt their sleep cycle. Just like the longer we go without eating, the hungrier we are. It's the same thing with sleep. The longer you go without sleep, the more that sleep drive builds up. And I'm sure a lot of parents out there have reprimanded their children before because they're eating a snack too close to dinner time, right? And, hey, don't eat those because you'll ruin your dinner. You ruin your appetite. And it's the same thing with naps and sleep. Don't take that nap. You're going to ruin your sleep appetite. So really try and limit naps and build that sleep drive up. So then when night comes, they're as prepared as they can be to go to sleep.
And then that's going to reinforce that circadian cycle where
Exactly.
it's going to be easier to fall asleep if I'm tired.
Exactly. Exactly. So we want that sleep drive to build up and we want that circadian cycle to be regulated as much as possible. And naps are notorious for disrupting that. So, and then, if you have a high school student and they drink coffee to wake themselves up in the morning, that's perfectly fine. But you really want to limit that caffeine intake and really keep it to the morning as best you can. Bare minimum, I would say no caffeine at least 6 hours before bedtime, and be mindful of what has caffeine in it. People assume that it's just coffee, but a lot of teas have caffeine in it, and even when they say decaffeinated, there are still slight strains of caffeine in there, so there's a difference between decaf and caffeine-free. Um, Sodas, unfortunately, a lot of kids drink energy drinks throughout the day. You really want to
That
watch
would be
out
a
for
clue,
that.
wouldn't it? If it's an energy drink, that's probably going to have pretty good amount of caffeine in it.
Oh yeah, among other stimulants, none of which are great for the body. But yeah, if your kid is putting down a Monster Energy drink as soon as they get home from school because they got a lot of homework to do, that's going to be problematic. So, like I said, bare minimum, you want to cut off caffeine intake at least 6 hours before bedtime, and do your best to limit it to the morning time.
Some regular soft drinks also have caffeine, don't they?
Yeah, watch out for your sodas. Absolutely, absolutely. And again, decaf, a lot of people drink decaf coffee thinking, well, no caffeine, but there are slight traces of caffeine even in decaffeinated beverages, and a little bit can make a big difference. So be mindful of your food labels.
Okay.
All right. A few more bullet points on a healthy bedtime and sleep routine. So the sleep environment, we want to keep this consistent all night, every night. What I mean by that, fall asleep in your bed, and fall asleep in your bed every night. Don't get used to falling asleep on the couch. Don't get used to falling asleep in another room. If you have younger kids, getting in the habit of getting them to fall asleep in their own bed is excellent and often, unfortunately, problematic. But if some nights they're falling asleep on the couch and some nights they're falling asleep in mom and dad's room, it's going to make it a lot tougher for them to fall asleep in their own bed. And that goes back to the association that you're talking about. I want to associate the bed with sleep, but it's not just the bed, it's my bed. I want to associate my bed with sleep and not other areas of the house. Uh, if you have blackout shades in your kids' room, keep them down every night. If they sleep with a nightlight, make sure the nightlight is going to stay on throughout the night, because what we'll talk about in a couple of minutes is a kid goes to bed with the nightlight on and they're comfortable with that, but when they wake up in the middle of the night and they see the nightlight is off, that's jarring. And that can be enough to stir a little bit of anxiety, which can be enough to keep them up. If they're falling asleep to classical music, let's say, keep the playlist on repeat. That way it's playing throughout the night. That way if they're going to sleep with music on, they're waking up with music on. Again, anything that changes from how they fall asleep to their mid-evening environment, that can make a difference. That can make a difference. Then we have the tech-free bedroom and bedtime routine. So no tech for at least an hour or two before bedtime. I put a couple asterisks next to this because I understand that that is asking a lot, especially if you have teenagers.
I'm reading your footnote. If this won't wreak havoc on your household.
Exactly. So
I'm thinking about teenagers, and you're going to tell your teenager no tech 2 hours before bedtime.
Yeah, so if that's going to cause a tornado in the house, then negotiate a little bit. See what's reasonable. I understand how pervasive tech is in our lives, and how necessary it feels for most teenagers. And I'll admit, as a young adult, I am guilty of this too. But the less tech you have in those couple hours leading up until bedtime, the better chance you're going to get for good sleep, especially if it's a circadian rhythm issue like we were talking about before. Now, if you have younger kids where they haven't gotten into the entrenched habit of their iPads or their phones or whatever else, then start that now. Start the tech-free bedtime routine now, and make a little central charging station in another part of your house. The kitchen can be kind of the place where everybody charges their phones and their tablets and their computers, and that's where they'll have to go get it when they wake up the next morning, because they won't have it with them during the night.
That's a very clever idea, and that's a way for the parent to see that the tech devices are actually not in the bedroom.
Yep, absolutely. It's good for some compliance monitoring as well. Yeah, that's a good point. And so, like I said, within reason, But if you are a parent of younger kids and this hasn't become an issue yet, then hey, do everybody a favor and nip it in the bud while you can. So, no big meals or lots of liquid before bedtime. Uh, you want your body to be in sleep mode and not digest mode. That being said, a little healthy snack an hour or so before bed can be helpful because you don't want to go to bed hungry. You don't want your kid to go to bed hungry. That can actually cause them to stay up. But at the same time, um, you don't want them having their big dinner at 8 and then winding down to go to bed at 8:30. You want to spread those out a few hours apart. And of course, lots of liquids. They're going to have to wake up to go to the bathroom in the middle of the night. So empty bladder is as good as you can get there. And then keep the bed just for sleep. Like I said, kind of turning into a running theme here, but it really, really is super important to do. Okay. So I just want to cover nocturnal enuresis for a couple of minutes. Like I said, much more common in boys, usually age 5, 6, much more common in boys than in girls. And the great news about this is a treatment came out a long time ago and it's worked ever since, and we haven't had to revise it a whole lot, and that's the bell and pad method. Why does it work? It works through conditioning. So you'll see I have this kind of little diagram here, and none of these diagrams are fancy schmancy. They're all easy to find on the internet. And what you see is you kind of have this waterproof sheet that goes under the fitted sheet. It's attached to this little alarm here that goes on the nightstand, connected by a cord. You put everything else under that, and as soon as any moisture is detected on this waterproof sheet, the alarm sounds, right? And basically over the course of time, your child is going to start to recognize that the alarm is a signal for moisture. And what that's gonna do is help with them recognizing that their bladder is full, really, before emptying it, before they wake up.
And is this something that a parent can get on their own, or would they have to go to their pediatrician if they're having this issue?
You can get it on their own. In terms of specific brands, you can always ask your pediatrician. You can always do a little research online, but these aren't any.
I think we lost the audio again just for a moment.
I'm going to say enuresis because it really is very straightforward.
If you could repeat that last part once again.
Okay.
We just lost
How are we
the
doing
audio.
here?
Yeah, well, now we're back.
Sure. Can you hear me okay?
Yeah, for some reason the audio
Okay,
cut.
good. So yeah, like I said, this is over the counter. You don't need a prescription for this, let's say. You can get it yourself. And this is really all I'm going to say about that because it's quite simple and effective strategy to use. And I want to talk in a lot more depth about some of the more, what I would say, complicated behavioral issues related to sleep.
For a child that's having this issue and the parent gets this system, what would be typical as far as how long it might take for there to be some improvement?
Not very long, a couple weeks maybe.
Gee.
It's conditioning. Our bodies are very sensitive to conditioning, and when you're doing conditioning work, our bodies learn quickly. And if you have this nightly routine of an alarm sounding whenever there's moisture, your body's going to learn to wake up before that alarm sounds. The kid wants to sleep, and they also don't want to have accidents. Most kids would rather not have accidents. So the alarm is a good way for them to learn, okay, I got to wake up and go use the bathroom. And now I am aware of what that feels like thanks to this alarm going off whenever it detects moisture.
Wonderful. Thank you.
Sure. So behavioral insomnia. Behavioral insomnia is a type of insomnia that is specific to children, and it is divided into two subtypes, so I'll talk about both here. Well, I'll start with sleep onset association, and this is usually what you see in younger children, infants and toddlers, so usually in the 6 through range. And basically what sleep onset association insomnia is that I can only fall asleep under certain conditions, and without those conditions, I can't. And I kind of alluded to this a little bit earlier. And some of these examples are rocking your child to sleep, feeding them in bed or next to the bedroom or next to the bed in the bedroom, having your child fall asleep in the parents' bed or outside of their own bedroom, music or nightlights at bedtime. And not only can they not fall asleep without those conditions, but if they fall asleep with those conditions, they won't be able to fall back asleep without those conditions in the middle of the night. And this over here is what I was alluding to a little bit earlier. If I fall asleep while some nice, relaxing classical music is playing, but then I wake up in the middle of the night with no music, that is going to be enough to prevent me from falling back asleep. Basically, what your young child or infant's body is saying is that I don't know how to sleep under any other conditions except for the ones that I've learned. And as parents, how could you not want your child to go to sleep as soon as possible in the most soothing way as possible? So if that's rocking or feeding or falling asleep in your own bed, hey, if it gets them to sleep in a timely manner, then yeah, of course I'm going to be more likely to do it. The problem is when those conditions aren't present, the kid has a really, really tough time falling asleep.
And that would actually be a form of insomnia now.
Correct. Correct. That is a form of behavioral insomnia, which is specific to children. And sleep onset is usually what we see in infants and toddlers. So then what do we do?
So how do we address that?
Right. What do we do about this? What's the solution here? Well, the solution is what's called extinction. And this can either be done what's called quote unquote standard or gradual, and really this depends on the parent's comfort level. So first I'm going to start with standard extinction. What I mean by extinction is we are really extinguishing a learned response. The learned response here that we're trying to extinguish is sleeping under very specific conditions. So what do we do with standard extinction? Well, we remove all of the unhelpful associations all at once. So if you're rocking your kid to sleep and you're singing to them and that's happening in your own room and not their room, we want to stop all of that at once, okay? We want to go directly to putting your child in their bed and having them sleep on their own without your help or in another room, right? And what goes along with this is a lot of mental fortitude on the parent's part, because the parent is then going to be ignoring cries at bedtime, which the parents are often probably used to responding to those cries by going in and checking on the kid, which then reinforces the crying as something that helps get your child what they want. And so we're ignoring those cries at bedtime and during the night until they learn to fall and return to sleep independently. Now, it's important to know, this is a little bit of a disclaimer, the crying is going to get worse before it gets better. And that is very typical of any behavior that you're trying to get rid of, any unfavorable behavior. So with the crying, you're doing a good job of ignoring their cries at bedtime and during the night. Well, they're going to cry a little extra before they start crying less. But generally, this results in improvements pretty quickly, a lot of times less than a week. And the second night is typically the worst. The first night's pretty bad. The second night's the worst. A lot of people see improvements by the third night. Usually, if not the third, then the fourth night. And you start to see improvements in less than a week.
Now, I
Now,
have a question, Dr. Brandt.
sure.
So I understand the concept,
Hmm.
and I can certainly see this could be very tough on the parent to go
Yeah,
through.
yeah.
But my question is, what would you say to the question of, well, how is this going to be in the long run for the child? Is this going to be some traumatic thing for the child that's going to hurt her in the future, or is the child really going to be okay after the first couple of nights?
They're going to be okay. And I know that this is a little bit of a hot button topic, so I appreciate you bringing that up because it's worth addressing. The child will be okay. There is a lot of research that has looked specifically at what does this standard extinction protocol do for a child's mental health long term, and the answer is nothing. The answer is it does no harm long term for the child. The toughest part is the distress that they feel for those couple of days, but that is not because, and if you don't mind, I'm actually going to go to the next slide because it touches on that a little bit. It's not because, so this is probably what it looks like in much less cute fashion. Um, but they're not crying because they're in pain. They're not crying because they're feeling like they're in danger. They're not crying because they're traumatized. They're crying because they're frustrated. And they're crying because they haven't learned how to sleep this way. That's what they're really crying about is, I don't know how to sleep like this. I only know how to sleep another way. And I don't know how to do something I haven't learned yet. Um, and this teaches the child how to relearn. But we are talking about short-term benefits for both the child and the parent because everybody's going to be sleeping better, and a ton of evidence that this doesn't harm your kid long-term. They're not going to be traumatized. This doesn't put them at risk for any other kind of mental health or behavioral issues. It doesn't hinder their development in any kind of way. It's just really tough to hear your child cry.
It's giving their lungs a lot of exercise those
That it
couple of
is.
nights.
That it is. And really testing the parents' patience. Um, and not just their patience, but like I said, their own mental fortitude. Nobody likes to hear their child cry and in distress. And it's instinctual to want to respond to that. And it's instinctual to want to respond to that ASAP. But when we do that, when we respond to the kids crying ASAP, we are reinforcing the crying. We're just perpetuating the crying as a way that the child is learning that the crying is a way to get the comfort that I want right now. And yes, even 6-month-old babies can be conditioned in that way. So that's sleep onset issues. Now, well, that's standard extinction for sleep onset issues. Now, there's also the gradual approach, which is, I have 4 kids, and it's exhausting enough as it is already. If I have the kid crying for an hour to 2 hours at night and it disrupts the entire household, I simply can't have it, and I'm tired enough on my own. Okay, then maybe the gradual approach is better for you. And obviously, usually the gradual approach isn't specific to that scenario. But if the standard approach seems, you know what, that's a little too tough, then you try the gradual approach. So through the gradual approach, you're not just going cold turkey with your child. You're kind of putting them to bed, and then you're checking on them at set intervals. So you're still not responding to the crying necessarily, but you are checking on them. You are providing them with a little bit of reassurance. So, and then you want to do that. You want to extend that interval each night. So maybe that first night you check on your child every 5 minutes. Then the next night it's every 7 minutes. And the next night it's every 10 minutes. And believe me, you want to go with the small increments because those 2-minute increases can seem like a lot. But you want to extend those intervals every night to start to get the child more comfortable with being in their room alone for longer sets of time, longer periods of time, rather. You want to decrease the duration of those associations at bedtime. So if you're rocking your child to sleep every single night, you want to do that less and less. So if you're doing that for 20 minutes, you want to cut that down to 15 minutes, and you want to get to a point where you're um, putting the child to bed. Let's say you're rocking them to sleep. You want to put them to bed not necessarily when they're already asleep, but you want to kind of catch them when they're in that little twilight period where you're noticing that they're sleepy, they're well on their way to sleep, but they're not completely out yet. And then you want to put them in the bed. And as you decrease the interval of this kind of bedtime association behavior every night, you are putting them in their bed when they're kind of less and less sleepy. So they will be a little more alert as time goes on as you do this, but again, at least you're kind of gradually getting them off of these associations as opposed to the kind of cold turkey standard method here. When you are making your check-ins in the middle of the night, they ought to be quick and they ought to be reassuring. You don't really want to be overly effusive. When you kind of burst in the room and, oh my goodness, are you okay? I hope you're doing great. You're doing such a good job. Everything's going to be okay. I know how hard that is. Well, what you're telling the child is what they're doing is really, really tough. And kind of reinforcing to them that this is kind of painful here, that it shouldn't be like this, that you're asking me to do something that inherently feels like it's not okay. But when you keep it quick, when you keep it reassuring, still give them praise. Hey, you're doing a great job of staying in your bed. But you don't want to be hugging them or holding them. You kind of want to give them a little encouraging pat on the back and say good job and be like, okay, I'll be back later. And so at first, this message is going to help going to sleep at night. At first, the nighttime awakenings won't get a whole lot better, but over the course of time, this method will also translate to the nighttime awakenings. So if the standard protocol for extinction is you're seeing improvements in less than a week, because we're going a little more gradually here, you're probably talking about a couple weeks, a few weeks to see some sustained improvements.
So either method is fine. It's just the gradual will take longer, but is also effective.
Yes, it's also effective and just might simply be more comfortable for a lot of parents.
Great.
So those are sleep onset issues. Then we have the limit setting issues. And these are most common during preschool age and school age. And with this, you see a whole lot of stalling or refusal, we call it. So that bedtime routine takes forever. We're talking about a couple of hours to get through the brushing the teeth and taking a bath and putting on the pajamas and story time with mom or dad. That's not happening efficiently. That's taking a very long time. With complaining, with stalling, with arguing, and then once they do finally get to bed, we're having these curtain calls. And, well, this was kind of the best image I could gather up for a frightened, it didn't even look like a child, but someone emerging from a curtain.
Right.
And that is...
I'm taking my 6th curtain call before bedtime.
Correct. Or even after bedtime is when you see it a lot is, all right, show's over, time for bed, and your child assumes that, well, time for a few encore performances here. Time to bust out of the bedroom and complain about how I can't sleep. Time to finagle my way into mom and dad's bed. It's the awakening and leaving the bedroom after you initially do finally fall asleep. So like I said, this leads to tantrums, this leads to arguments with parents. One important thing to consider is this last point down here. As kids get older, they may not feel tired until later in the evening.
So that goes back to one of your very first slides about
Correct.
the change in the need for sleep as kids get older. Yeah.
So if you have a 4-year-old and they're going to bed at 8 o'clock, okay, 7:30, 8 o'clock, okay, and a couple of years later, you want to keep them on that same bed wake time because you're really good parents about keeping boundaries and limit setting and all that good stuff. Well, now all of a sudden, they're having a hard enough time going to sleep at 7:30, 8 o'clock, and that's not because they're necessarily becoming oppositional. And that's not necessarily because they're scared of going to sleep. Their bodies just are not wired to go to sleep that early anymore. And if that's the case, you might want to think about ways to implement a later bedtime. So what do we do about this? Consistency and follow through is really important. And that is ubiquitous for any behavior that you're going to try and shape. That doesn't just go for bedtime behaviors, but if you are working on other behavioral issues with your child that are specific to daytime hours, if you're working on improving anxiety with your child, not just at night but during daytime hours, then consistency with limits and follow through is going to be really, really important. And on that note, a great way for consistency is rewarding positive sleep behavior. And we can do this through a token economy chart, which I'll show you a couple of examples on the next slide. What's really important to keep in mind, reward is much more effective than punishment. Always, always, always. You want to reward good behavior instead of punishing bad behavior. It is way better for shaping the kind of behavior that we want. Aside from the fact that, hey, we don't really want to, and look, punishment doesn't mean don't discipline your child. You absolutely should reasonably discipline your child. But with a lot of disruptive behaviors, that punishment is kind of a backwards reinforcer for your kid, because what's happening is many of you are probably familiar with the term any press is good press, and your kids feel the same way. So if they learn that disruptive behavior gets your attention, well, the attention is what they're looking for, and so they're going to do the disruptive behavior again because they've learned that it's helpful. So really what you want to do is do your best to ignore disruptive behavior and do your best to reward positive behavior. One of the things that you can do in addition to a token economy chart, which I'll show you again on the next slide, is a sleep fairy. Just like you have a tooth fairy who rewards your child for losing their teeth, which didn't take much effort except for wiggling a really loose tooth. Well, now we're going to reward them for effortful behavior, staying in bed longer in the middle of the night, staying in bed in a dark room, checking off all of the items on their bedtime routine and getting to bed in a timely manner. If they're doing all those things well, then maybe the sleep fairy concept is a really nice way to reward them first thing in the morning, because they'll be excited for it too, is the other thing. If they know the sleep fairy is coming, if you've had a child who's lost a tooth, you know how excited they are to put that tooth under their pillow and wake up the next morning to find a nice little prize there. The same thing will hold true here. If they know the sleep fairy is on their way that night, they're going to want to follow through. So that's a really kind of a fun way to implement some reinforcement. And again, not just the tangible stuff, but labeled praise too. You did a great job sleeping in your bed all night last night, or you did a great job brushing your teeth and taking a bath and putting your pajamas on when we asked the first time. Be very specific in the behavior that you are trying to tell your child they did a good job with. And give your kids a heads up before winding down for their bedtime routine. Let's set the expectations a little bit. If you have a child who is knee-deep in a video game or their homework or anything else that's an interest to them that's not part of the bedtime routine, let them know, hey, look, 15 minutes until we start our bedtime routine. Or give them an hour's warning and then let them know you're going to remind them again when there's 15 minutes left. But do everybody a favor, yourself included, and set the expectations for the kid that, okay, after X amount of time, it's time to get into that routine. And we're not going to barter with that. There's no negotiating on that. Do I still got you there?
Yeah,
Okay, just
so we're
making
going to
sure.
have to start winding up. Maybe you could
Sure.
have take a peek at the next slide.
Yeah, sure. So let's these are a couple
Oh,
of bedtime.
bedtime chart. Kid.
Yeah, yeah. So these are a couple of ways that you can structure your token economy. Basically, what a token economy is, a you pick a set of specific behaviors that you want your child to do. In this case, we're talking specifically about bedtime, right? Every behavior that your kid does, they get rewarded with a ticket, with a sticker, with whatever it is that they can kind of put, right in this little box over here, or right in this little box over here. And for however many stickers they accumulate throughout the week, they can trade those in. They can trade those stickers in or tickets in for a larger prize. You want the prize to be reasonable, okay? You want it to be something that they're going to really like and look forward to, but not too big. So if they do all their bedtime routines, really well for a week, then maybe they get to have dinner at their favorite restaurant, or maybe mom or dad takes them to um, a ball game or a concert. Something that is nice, you know. Do you want to reward them with a new iPhone or a new car or something like? Probably not, because it's going to be a lot harder to shape other behavior down the line. But something that's reasonable and exciting definitely can be helpful here. So the whole idea is you pick the behaviors that you want to be part of your bedtime and sleep routine. You reward them for every time they perform that behavior throughout the week. And if they've done it enough times, then they get to trade those stickers or tickets in for a bigger prize.
So you could actually have something like this made up and have little stickers that you get maybe at Staples or Office Max, little gold stars or little decals that you
Absolutely.
would put on the chart. Well, I'm sorry that we've run out of time. I'm
Oh,
hoping that
that's okay.
we can have you back for a part two.
I would love that. That would be great,
I
absolutely.
want to thank you so much. For our audience, we'd love to have you send in questions on
Yes,
this
yes.
topic. And we're looking forward to having Dr. Brand back to continue this topic. Really, really appreciate it, Dr. Brand. So
Thank you. My
bye for
pleasure.
now,
My pleasure.
everybody, and we'll look forward to seeing you next time.
Excellent. Thank you so much. Thanks for having me. And I'm just going to scroll right to the end here. Get to, there we go.
Okay.
All right.
Thanks,
Thank you so
everybody.
much. Thank
Thank you.
you.